say how much I'm happy to be here. Thank you very, very much for asking me. I think I spoke at this same meeting last year. I was kind of, when I got the email from Brandon, by the way, I want to congratulate Brandon Rawlings for receiving the Thaddeus John Bell Endowment Scholarship.
Oh, thank you. Thank you.
And I'll tell you a little bit about how that came about. To kind of put this in its proper perspective, I'll tell you a little bit about myself. I started off as a school teacher. I taught at Charleston High School, which was right across the street from the Medical University. And after teaching school for 5 years, and after making several attempts to get into the Medical University, which was not successful, I had to go to graduate school and then apply back. This has been a lifelong journey for me. I need to let you know that I was a part of the civil rights movement. Now I know that dates me, and that's okay. I was telling my daughters a couple of years ago, they were not aware that I was one of the students that marched during the sit-ins back in 1966 when I was in college. And the reason that I tell you that is because I think it kind of frames where I'm coming from and why I'm so passionate about the health disparities. So I entered the Medical University in 1972. Historically, the Medical University was not accepting any African American students at that time. It started accepting African American students in 1968. So I was not the first African American student, but I was in the first 10 that got accepted here and ended up graduating. So I can tell you that in that context, it was very, very difficult. It was a very racist institution. We, as African American students, there were 5 of us in my class, 5 males in my class. The university, as a rule, let us know that we were not wanted here, and they did everything that they possibly could to discourage us to drop out. And I can tell you that I did consider dropping out on several occasions. So in that context, while I was a student here, I saw a lot of bad things that really upset me as a young student preparing to be a physician. One of the things that I immediately recognized as an African American student here at this institution was that African Americans were not treated with dignity and respect. That was very obvious to me. And that we did not have, well, obviously we did not have a whole lot of African American healthcare providers. In fact, I never saw an African American doctor almost the whole time that I was here. So that affected me in a very, very negative way. I could not understand how I was getting ready to get into in a profession that professed to treat everybody equally when in fact that was the thing that it did not do. So I went on and graduated from here and did my residency in family medicine at Richland Memorial Hospital in Columbia, South Carolina. And then one of my professors saw me in the grocery store. One of my professors from the Medical University saw me in the grocery store. I was working at a health clinic down in Beaufort, South Carolina for poor people. And one of my professors saw me and invited me to come back to the Medical University to work as an attending physician at the VA hospital. And that's where my journey at the Medical University started again. I can tell you that I came back to the medical university with a lot of hesitation because I hated the place. And every time I walk on the campus, I experience PTSD, post-traumatic stress syndrome. I just remembered all of the bad things that I had to endure, all of the names that we were called. But I came back anyway, and I worked as an attending physician. And then Dr. Leighton McCurdy invited me to be a part of the faculty and be the assistant dean for minority students at the medical university. That came about as a result of some African American students in the early 90s came to him and said, we don't like the way we're being treated, racism is rampant, we wouldn't encourage anybody to come here of African American descent. The dean got very, very upset with that, and he asked me would I come back to the university to help him change that mindset. So I came back and I was a faculty member in the family practice department and assistant dean for minority affairs, in which my role was to knock down a lot of the barriers, particularly that African American students had to deal with, and to just make the university more diverse and to make the university better. After being here for about 3 years, the president of the university, Dr. Jim Edwards, asked me would I take over the Office of Minority Affairs. And of course, I explained to him that I didn't have any experience in dealing with minority affairs other than just my gut feeling on making sure that people were being treated right. His primary objective was to increase the number of African American students throughout the entire university and all colleges. Because the university had a history, particularly among African American students, as being a very, very racist institution. And so therefore, the number of African American students here was very, very low, and students went other places. So my job was to change that. So I was promoted to Associate Dean for Minority Affairs in the College of Medicine and Director of University Diversity for all 6 colleges. And I stayed in that job for 10 years. In fact, Raymond Greenberg came in as provost of the university during the time that I was director of the Office of Diversity, and then he eventually became president. So I worked for Raymond Greenberg and worked with him for a number of years. Now, during that period of time, I noticed that health disparities was wide, particularly at this university, but a book came out and the name of it was called Unequal Treatment. If you get a chance, you should get that book and read it. But the bottom line was that the book said that the health disparities did not only exist in South Carolina, but the health disparities was widespread throughout the entire United States. And it just kind of validated some stuff that I had been seeing as a student, as a resident, and then as a professor here. By the way, during this time, I maintained a private practice in family medicine in North Charleston. And so my private practice was a very interesting one, and we'll tell you a little bit about that. So I got very, very interested in the health disparities. However, I noticed that from a political standpoint, it was not something that doctors under ordinary circumstances would get interested in and talk about. And the reason why is because if you're going to deal with health disparities, you got to deal with why do they occur. As medical scientists, we want to find out, we want to look at the problem, but we want to find out why the problem exists. And when we started looking at why the problem exists, it was very ugly. And racism was at the top of the heap. Now, racism was not the only problem that impacted the health disparities. You need to understand that. But it was a part of the problem. And it was an ugly history that physicians, my colleagues, did not want to look at, did not feel comfortable talking about, and pretended like it didn't exist. In fact, this university pretended like it didn't exist. The irony of that is now this university is one of the leading universities in the country, I might add, of dealing with health disparities. And my colleague, Dr. Getty, has been a part of making that change. So, as a result of that, I started becoming a student of health disparities, looking at health disparities from all aspects, and I was trying to figure out a way in which I could make an impact on it. I knew that trying to make an impact on racism was going to be very, very difficult to do. Trying to change the hearts and souls of men was going to be difficult for me to do as an individual. But one of the things that I found out as a result of being a practicing doctor and also working here at the medical university was that particularly among African Americans and the underserved, a major reason that health disparities existed was because of the lack of information. Black people did not have good information about how to take care of themselves. You didn't have to dig deep. It was very, very obvious. And so I decided that I would study that and try to find out what I could do to change that. And so closing the gap in healthcare for African Americans and the underserved was born out of trying to find that out. Now, what do I do? Well, I write. Perhaps you've seen me on television and you've heard me on radio, but I write health tips directed particularly at African Americans and the underserved. I don't get real deep into what diabetes is. I just explain to people that if you have sugar, you gotta take your medications every day if you're going to do well. Now, you may think that, well, that should be obvious. Well, no, and Dr. Getty will tell you that's not obvious. There is a big gap, a big communication gap, and a big health literacy gap when it comes to African Americans and the underserved. Case in point, hypertension is a major health issue in the African American community. It contributes to strokes and heart disease. We have excellent medications to treat hypertension. However, I can tell you that in your profession, you will see many patients who will not believe that the blood pressure medicine works and that they need to take it on a daily basis. So I talk about that. I'll give you an example of a health tip that you're going to be hearing on radio that I just wrote last week. You'll appreciate this, Dr. Getty. A religious lady came to my office and she said that I diagnosed her as having having diabetes, and she said she wasn't going to claim that. Now, for black folks, you've heard that a lot. She's a religious woman, and she said she wasn't going to claim that, and she wasn't going to take the medication. So I wrote about that, and then I wrote also about how I thought about it. And the only thing that I said is, lady, please. Because those are the kinds of things that we hear all of the time. Sometimes we hear that a lot of African Americans still feel that the Lord is going to take care of them, so they don't need to do what doctors want them to do. Mm-hmm. And so they stop doing what you recommend because the Lord is going to take care of them. So I attack that craziness. Okay, and that's crazy. But the way that I do it, I don't do it in a way to make anybody feel bad. I write it in, by the way, I write these little health tips. They have to be done in 55 seconds, so I have to tell a story. The story has to be kind of funny, it has to be culturally sensitive, but it always has to have a message. And so I've written over 1,000 of these, and they have been on radio and television. We've been very, very fortunate throughout the state of South Carolina. We just got a major grant from Blue Cross Blue Shield to produce and put these radio tips on all of the urban stations. And then we got a big grant from the city of Charleston to be on television. We've been recognized nationally, locally, and etc. So that's what Closing the Gap in Healthcare is all about. That's one of the things. The next thing that I recognized when I was a student here is that one of the reasons that the health disparities exist and continue to exist is that we don't have enough African Americans in the healthcare profession. It became very obvious to me that in the state of South Carolina, we represent 35% of the state, yet we only have 4% of the healthcare providers of African American descent. And if you read the literature, you will find out that people like to be taken care of by people that come from a background like theirs and look like them. Now that's not to say that they're not going to listen to other folk, but they prefer, if you're a black patient, they prefer you being taken care of by a black patient because you're probably going to understand the social problems and the things that they have to deal with in their world. Okay? That's just the way that it is. And so I recognized that I needed to try to do something to increase the number of African Americans in the healthcare profession here at the Medical University. So I said, well, you know, I'm gonna do me a jazz festival. Now you all may laugh, but I started a jazz festival. I had about $100,000 and it was getting to be very, very difficult for me to get grants to do what I needed to do. So I talked to some people and they said, well, you know, smooth jazz is something where you may be able to make some money and use the proceeds from it to start a scholarship. To make a long story short, we did start a scholarship. We've raised over $300,000. It has already been endowed, and every year we give 2 scholarships to 2 African American students at the Medical University. Now, can anybody tell me why I only give it to African American students? It's not because I don't like white people, all right? But do you understand why, when I wrote the criteria for it, why I said it must go to an African American student? Can anybody tell me that?
Get more African Americans in the healthcare field.
Get more African Americans in the healthcare field. That's exactly right. One of the things that I recognized when I was associate dean and director of the Office of Diversity, and I looked at all 6 colleges, I noticed that African American students in all 6 colleges were very bright. Medicine students were just as bright as dental students, pharmacy students, everybody was bright. If you got accepted here, you were bright. But there was one barrier that all of the African American students had. And what was that barrier?
Financial.
We had no money, okay? Most of us are first generation physicians. In other words, our parents were not doctors, our uncles were not doctors. We are first